Nothing contained in this podcast should be considered a substitute for professional medical advice. This content does not represent our respective employers and is purely the opinion of the podcast hosts. We are not your personal medical providers. Sorry, friends. So, if you have concerns or are seeking a diagnosis or treatment, please seek individual advice from a healthcare provider in your area. We are not liable for any risks associated with acting upon the information contained in this podcast. This is intended for educational and entertainment purposes only, so enjoy the ride.
Please drink responsibly and in moderation. Before drinking, please be sure to be of the legal drinking age for your country. We do not encourage the misuse of alcohol.
Welcome to Medical Media Mixer, the perfect cocktail. I'm Nicole Peniston, psychologist.
And I'm Tara Prisco, physician assistant. And we have both survived the blizzard of 2026.
For now, it's supposed to snow again in 2 days.
I know. And then again Friday. I know.
Yeah.
It's bad. We both have power and internet.
We both have power, knock on wood, and internet.
Yeah.
And I will say because I have a side gig, that is not this. My side gig, they closed their physical offices for the entire week.
Oh, wow.
Now, I've always been telehealth for them, so it does not impact
Doesn't
me.
matter. Right.
But they closed all of their offices for the entire state for the whole week and just told everyone to do telehealth. My full-time job, they closed the office today and tomorrow.
Tomorrow's still sort of up in the air for mine.
Yeah.
But my street has not been plowed since midnight, so there's more than a foot of snow in my street, and I live in a cul-de-sac, so we are last on the priority list.
Yep.
So our driveway, thank God for the snowblower, but it was hard because there were parts where the snow is higher than the snowblower.
Yep.
And my little one actually came out and helped with the cars. Like I cleared them, but like digging around the tires and stuff like that. And she like shoveled the steps. I was so surprised that she actually did a lot. My older one, just for the listeners, she's on crutches, so she couldn't help. So she got to stay inside.
She got out of snow shoveling.
Toasty. I was telling Nicole before that I've made her fold 6 loads of laundry this weekend since she can't do any other chores.
She put her work in, yeah.
But I have to say, like, that snow when I was shoveling, I was literally getting dizzy for a few minutes. And the little one's looking at me like, "Are you okay, Mom?" I'm like, "Yeah, just need a minute."
I saw an article yesterday that said the most dangerous ages for shoveling snow are 45 to 50.
Okay, wow.
We're falling in that range, unfortunately. Actually, I was really proud of myself. I woke up very early and went out and shoveled just like from my door to the sidewalk. The sidewalk had not been shoveled yet, so I just shoveled that. And then I had some telehealth folks, and then I went out like midday-ish, and a bunch of my neighbors were out. And I do have very lovely neighbors. I don't think any of them listen, but shout out to them. They all we all helped each other, like cleaned off each other's cars and moved the car, shoveled the spot, then parked in. Yeah. There were a couple of spots that were empty. So like they kind of like made sure that like everybody who was out there was taken care of. A couple folks weren't out there, but it was okay. But it was so annoying as we're all shoveling, and it was probably like 8 of us out there like doing the work together. Our like landscaper people, they drove by in like one of those like construction like vehicles.
The little cat thing.
They didn't even have the plow down.
Okay.
And then we tried to wave them down to like clear out because there were like 3 empty spots. We wanted them to just like plow that snow. Right. Drove by, ignored us. Now, I also live in a cul-de-sac, and there were 2 other groups of people who did the same thing, and the guy just drove past them and ignored them. It was like, why are we paying for maintenance if you guys are just going to drive by and completely ignore us?
Right. Lovely. I mean, that's when you live in a development like that. Like I lived in a development like that previously. And I remember one of the big snowstorms we had. So it had to be
2009.
Yeah. Yeah.
It was my first year of grad school.
Yeah. And like the drifts were up my garage 4 feet, and we had like a big courtyard area, and like they didn't clean it for days. Like it was bad. Now I'm reliant on the city, which again, it's hit or miss. I know they're trying, they're doing their best. Yeah. But kids already are out of school tomorrow. So
yeah. I mean, I feel like it's the whole state. Like luckily, knock on wood, I don't have to go to work tomorrow, but I did go out and clean out my car just in case. But I feel like there are people who live in developments who are nurses or doctors or things like that who have to get out. Like these people like don't care that people have to leave their houses. Or like, God forbid there's a medical emergency and somebody has to get out. Like they don't care.
Right.
So a bunch of us were mad at the maintenance people. And my mom's like, you guys should go to the meetings. They have the meetings once a month. I'm like, yeah, I know.
President, I vote for you for president of the board.
I don't want that job. No.
When we lived in
have
development,
anything
they were
do
trying to
with that.
get my husband to be on the board.
Oh God, no.
Yeah.
I mean, you know me. They don't want me as president. They don't want somebody this mouthy out there. No.
They need to hear
That's
it.
the same reason why I'm never going to be in a cult, because I ask too many questions and I don't take no for an answer.
Oh my goodness. Wait, have you seen the show The Burbs?
Not yet.
It's really good.
You know
have
it's a
to
remake.
watch it. Yeah, it's a remake of there's the book
Tom Hanks
and
movie.
the movie.
Yeah.
But this one, it's what's her name?
Keke Palmer.
Keke Palmer. She's great. Her
Yes.
outfits in this, very like 90s, like color blocking, bright color and stripes, like
I've seen the
spot
preview, yeah.
on. It's really good. I really
It looks
enjoyed
cute. I keep seeing the previews.
But it has like that, HOA and like the rules and all that. But it's actually pretty good. I binged it in like 2 days. I watched all 8 episodes. So
Yeah,
it was very enjoyable.
My Blizzard binge has been Bridgerton. Had to get the alliteration in there.
Yeah.
Yeah. So I'm catching up. I'm only on episode 3 of the 4th season, but I'm getting there. I'm getting there.
So actually, I just watched with the younger child. She was reading the graphic novels for Enola Holmes. Have you, Sherlock Holmes' little sister?
Oh yeah, I've seen all the movies
books, and there's the 2 movies.
I heard there's a 3rd one coming out.
It's
I don't know if that's
in,
real.
It is. No, it's coming in April or May. So we watched the first one night, and then today during the day we watched the second one. And actually, I'm going to do an episode now based on the second one because it's about like a real life thing, very similar to Radium Girls. There's a whole thing in that second.
I just love the casting in that. Millie Bobby Brown, phenomenal as always, chef kiss.
Yeah,
but Henry Cavill,
perfect,
and Helena Bonham Carter.
Oh yeah, yes,
like it could not get better.
I know.
The only way it could have gotten better is if it was the Sherlock that we all know and love, Benedict Cumberbatch.
Yes,
and Martin. No,
the guy from
Martin
from
it's
Lord
Martin. Martin
yes,
something.
Martin something.
I always want to call him Martin Short, but that's
no.
It's similar though.
Yeah, it is.
Anyway,
it'll come. Freeman.
But Freeman.
I think so. Martin Freeman.
Let's go with that.
Let's Google that. Hold on. I think that's it. The guy from Lord of the Rings.
Blonde guy. He was also in Wakanda Forever. He was in Black Panther.
Yes, it is Martin Freeman. See,
he's the white dude in Black Panther.
Yeah. And back to the Enola, what's her name from Bridgerton, plays in that second movie. She plays Cicely / Sarah Chapman, the one they're looking for in the second movie.
I haven't seen it in a while, so I'm forgetting which Bridgerton
anyway,
person.
it's Francesca from Bridgerton.
I like her. It's funny though, my friend Marcia, who listens sometimes, she texted me and she said she needed a new job. And I said, I need to be Lady Whistledown so I can just gossip and marry a hot man who likes chunky girls and carriages. Like that's
seriously, that is like Penelope. Boom, she's got it.
I mean, I was Lady Whistledown for Comic-Con several years ago.
Yes.
And made my own papers that we handed out. But
really?
yes,
we made know that part.
They're little bookmarks. I can give you one. I still have some.
That's adorable. I love that.
So so what are we going to talk about today, my friend?
So we shuffled around our episodes a bit because of the passing of Eric Dane, and we figured that people would be looking for information on ALS. So we figured that would be a great way to sort of, this was planned for, I don't know, a month or so later. So we just kind of moved it up. My cocktail is good, but not what it looks like in the picture.
Okay.
So
tell me more.
So it's called the Black Hole Fashioned.
I saw that.
It's supposed to be similar to what they make at the Space 220 bar restaurant in Epcot at Disney.
I was thinking like Black Hole Sun.
Yeah, I mean, same concept.
Black Hole Sun.
There are a bunch of Black Hole Sun drinks. I was looking for that, but then the Black Hole makes more sense with the person I'm going to talk about in addition to Eric Dane. But mine's not black because there's no ingredients that are black. And I was trying to figure out why. Yeah, but that wasn't in there. I don't know. I'm not really sure. But it's essentially an old fashioned. It's 2 ounces. They said Knob Creek bourbon. I used Bullet because that's what I have. 0.25 ounce of Demerara syrup, which is just that dark brown simple syrup. 3 dashes.
I thought it was called Demara.
I don't know. There's an extra ER in there.
Demerara.
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 I've seen it spelled Demara. I think you're right, but this is how they spelled it here.
Look, I am drinking a margarita in honor of yesterday being National Margarita Day, and I've had a couple of sips, so don't go off of me on what things should be.
and then 3 dashes of whiskey barrel aged bitter. So that's an extra ingredient I did have to order, which is a little bit different than the regular bitters. And then, of course, the orange peel. So you take all the ingredients into a mixing beaker, as they called it. I don't know why they called it that. Maybe they're British. I don't know. I stirred 30 times. I did not count how many times I stirred. Straight into a rocks glass over a large ice. But I didn't have any like those large cubes made, so I just used
What if
regular.
that's the secret? That if you stir it 30 times it turns
black.
And you only stirred it 29.
And you express the oils of the orange peel and garnish with the peel.
Mm.
And then in Space 220, they use like a special smoke gun thing on it to make it smoky.
Mm.
But I don't know.
Smoke gun? You mean like a smoker, like a whiskey smoker?
Well, no. At least I know on the Disney cruise ship, they had one that was like a bubble and it filled with smoke. It was like a gun thing they use. I think it's the same kind of a thing.
It is.
Yeah. But anyway, it's not black, but it's an old fashioned. It's called a black whole fashioned. So
do you like old fashions? That's the question.
I do like them, but I don't do well with more than one brown liquor. I tend to get like a headache from it. So like clear liquor, I can have more than one. Brown liquor, one. We're good. So, but I do like the way they taste.
My friend from grad school, Steve, I don't know if he listens, but if he does, shout out to Steve. He always told me that brown liquor made him sad. So he couldn't drink brown liquor.
Yeah, I've heard things like different people. I mean, tequila is also one that can kind of do weird things.
I mean, tequila, anytime she comes to the party, she's going to cause problems.
Well, you're drinking a margarita, aren't you?
I know. That's why I brought her. I said, come on, girl. It's snowing out. We got stuff to do. I don't have to drive in tomorrow, and I don't have a patient until 2:00.
Wow, nice. Yeah,
my morning got canceled, sadly.
I don't know what my morning is going to hold, so we will find out.
I had one person who needed to reschedule because they have to work tomorrow, and I was like, are you sure? And then another person canceled, but they just moved to Thursday, so I actually don't have a patient until like 2:00 tomorrow.
All right, well, be productive. Catch up on things.
I will. I have reports to write, so I will be productive.
It's not like you're going to be sitting there twiddling your thumbs.
No, I was productive today, too. I had 5 patients, so I had a pretty busy day in addition to shoveling 24 inches of snow.
Yeah, I didn't do any work. Well, I just reviewed my inbox. That was it. All right, so just real quick before I jump into like my actual planned thing, let's just talk a little about Eric Dane, who just passed away. Yes. We're recording this on the it was 2 or 3 days ago I want to say the
21st he passed, or 20.
Yeah, so Eric Dane, he's born in 1972, an American actor
known as McSteamy.
Yes, he's most well known from Charmed, Dr. Mark Sloan on Grey's.
He was in Charmed?
He was a recurring role of Jason Dean.
Like early Charmed. Okay.
And then Grey's Anatomy was probably the thing most people know him from. He was also in X-Men, The Last Stand, Marley and Me, Valentine's Day.
He was in X-Men? My goodness.
The Last Stand, the 2006 one, whichever one that was. There's lots of X-Men movies, so I'd have to see.
I mean, there's a lot of people who are X-Men that I didn't realize.
Right.
So.
Yeah. He was also in that Valentine's Day movie back in 2010. I did see that. Remember that one? Burlesque?
Yes. Burlesque is not even on the down low. It is one of my favorite cult classics. I know every word. I know every song. I know all the choreo.
Oh, really?
All the choreo.
And then Bad Boys?
Hit it up. Sorry. He's in Bad Boys?
I don't think I've actually, the 2024 one.
I don't know if I've actually watched an entire Bad Boys movie. I'm familiar with the genre, though.
But most recently, he was in Euphoria, so a lot of people know him more recently.
And I did not see Euphoria yet.
No, I know, me too. And I think it's HBO. I have HBO.
Same.
I just need to watch it. But in 2025, in April, he announced he was diagnosed with ALS. And then he passed in 2026. So that was pretty quick. Just quickly about his illness. He said his symptoms had begun roughly 18 months prior to announcing. So we're talking a year and a half. Yeah. And then by June 2025, he had completely lost the use of his right arm. By October 25, he was using a wheelchair. And then he passed on February 19th, the age of 53. So, I mean, that's pretty rough. Now, we'll talk about ALS and the varying degrees of things because the main person and topic we're talking about actually lived well past what they were expected to. Mm-hmm. So I'm going to be covering the theory of everything.
Which I've actually also never seen.
No? Okay. No. It's a pretty good one. So it's a 2014 film, and it's covering the life of Stephen Hawking, who is the pretty much only physicist that you really know. Like,
No.
yay, physicist. Well, Neil deGrasse Tyson.
I was going to say hello. Yeah. Don't forget our boy Neil.
Yes. He's an astrophysicist as well. Yeah. But, you know, as far as like most life-changing discovery type person, you know, he's kind of been like this. Like, I don't know any other physicists. Like, those are the two. Like,
I mean, I feel like physicists don't typically make it to pop culture,
right,
but those two
exactly,
have. So,
also, if you watch Big Bang Theory, Stephen Hawking is a very large part of that. They talk about him constantly, and he's even on an episode.
I was going to say, doesn't he make an appearance?
He makes a cameo, yes.
Yeah.
So the film tells the story of Stephen Hawking and how it basically, you know, it brought global attention to him having ALS. So we'll talk about the film a little bit. We'll talk about some other people diagnosed with it, and then we'll talk a little bit about the Ice Bucket Challenge too.
I think you're going to appreciate this. I just quickly looked at Stephen Hawking's YouTube page just because I didn't remember when he was diagnosed or whatever.
Yeah.
And I read it that he was a cosmetologist. I was like, this man did everything. No, he's a cosmologist, not a cosmetologist. But who knows? Maybe he did makeup too.
Here.
I'm sure he could do a stunning cat eye.
Oh my goodness. So in the movie, he is played by Eddie Redmayne. And let's see, Theory of Everything. So it's a British biographical drama directed by James Marsh. And it's based on a book. So there was a book, The Traveling to Infinity, My Life with Stephen by Jane Wilde Hawking, who is his first wife. We'll get into his little drama there with the wives.
Right.
Yeah. So it actually was pretty critically acclaimed. It was, I guess it looks like it came out in 2014, Toronto Film Festival, and then general release later that year. Eddie Redmayne is Stephen Hawking. Felicity Jones plays his first wife, and supporting cast includes David Thewlis and Emily Watson. Emily Watson, we know.
All these others.
I don't know who those other guys. But it was very critically acclaimed. It was 80% in Rotten Tomatoes. Part biopic, part love story, as they call it.
Biopic or biopic?
I read it as biopic, but I thought it was pronounced as biopic, so
it's both.
Don't know. I think I've heard other people say biopic, so that's why I said it that way. I made a choice too, because in my head I say biopic.
I'm going with your choice.
In the outer choice.
The inner choice versus the outer choice. Okay.
So Eddie Redmayne won Best Actor for the Academy Awards, and it was nominated for Best Picture, Best Actress for Felicity Jones, and Best Adapted Screenplay, Best Original Score. It won Best Actor for Golden Globes as well, and the BAFTAs. It won several awards. That's the British Academy.
Which I was going to say, the BAFTAs were just this week.
Yeah, that just happened. So I'm going to basically go through his actual real life, which the movie essentially follows exactly his real life. I don't need to go movie plot. I'm just going to tell you his life because the movie covers everything the same. So he was born in January of 1942 in England, and he died in 2018. He came from a scientifically curious family. He pursued physics at University College, Oxford. He got a PhD at Trinity Hall, Cambridge in 1966, focusing on cosmology and general relativity.
General
relativity. Yeah. General relativity, I think, is the big thing he's known for. In the early 1970s, he proposed theoretical mechanisms by which black holes emit radiation. So now we know that is the Hawking radiation. And shows that black holes can shrink and eventually evaporate. Physics and astrophysics, not quite my specialty, so don't ask me any questions about that, okay?
It just blows my mind on how you can study something that as I'm saying, I'm like, wait a minute, that's what you do for a living. I was like, you can study something you can't touch. So yeah, I'm going to be quiet now. Sorry.
So he built on Einstein's relativity and quantum theory to explore the nature of black holes, singularities, and the early universe and how it formed. And he kind of crossed to two fields, quantum mechanics, gravitation, which advanced the field of cosmology and contributed to understanding of the way the universe started and its actual structure.
Is he the guy, because you said singularity, isn't there this whole thing about living in a simulation that has to do with singularity? And somehow it's related. I know that. I just don't know how.
I believe you. It's some of that stuff is too big for my head. I can't wrap myself
Basically, it's all pretend. It's all a dream. It's Who Shot JR in real life. No one's going to get that reference unless you're as old as us or older.
Or what's the other one? Twin Peaks. That I feel like that's all.
I never watched all of Twin Peaks. I know I'm a bad psychologist.
Yeah. The remake one, the more modern one, I would fall asleep watching it, then wake up, there'd be random colors and things
I
happening on
could
the
not
screen.
get through the first episode of the original Twin Peaks because I didn't care about who Laura Palmer was. I didn't care. Didn't notice, bitch. Didn't know about her. Didn't like her. Didn't care about her. They needed to establish more background for me to get pulled in.
I think the thing about the whole show is it's not, I don't know.
I know it's a cult classic. I know
so
I've offended
out
a lot
there.
of people right now.
It's interesting. It made my brain like, and I watched it all.
So no, David Duchovny's in it, right? We're really off tangent right now. Sorry.
That's okay. That's what we do. We can tangent. That's allowed.
I'm gonna give Twin Peaks another try just to try to redeem myself.
The original, I really do not recommend the newer one, although I think that one was critically acclaimed.
Aren't they related though?
But but I was like, I don't know. Am I like too dumb for this? Am I not getting something? I don't know what I'm missing here, but I'm not getting it.
I think that's part of it. I think you just need to give in to the not knowing.
Yeah, maybe I need to like go to our future 420 episode and like use a little.
I was going to say maybe you need a little something to help along.
Because my brain wasn't expanding in those ways. Okay, so our friend Stephen Hawking. So yeah, the movie follows his life, starts in the 1960s when he's at Cambridge. He's a brilliant guy. He's socially awkward because, science. And if we think about it, maybe people were not diagnosed with things like being on the spectrum probably back then. So I can't diagnose him, but,
So in a future episode, I will talk about the fine line between genius and mental illness, both creativity and intelligence.
Okay.
So TBD.
So he meets Jane Wilde, who's a literature student. Their love story unfolds while he's rising through his academic rigor. And very early in the film, they start to show like little peaks of him struggling physically. He trips, he struggles with balance.
And how old is he at this point?
He's in his 20s, I believe. So he was born in 1942. So this was in the early 1960s. So yeah, he's in his 20s.
Isn't that pretty young for those symptoms to start?
I believe so. Yeah, most people don't present that young. And again, we'll get to, he was not predicted to live
as long as he did,
nearly as long as he did. He falls when he's walking across campus and he's 21. There you go. Next line. He's 21 years old and he's diagnosed with ALS.
It's so young.
And they tell him he's got 2 years to live.
Oh, that's heartbreaking.
So that sort of shapes the trajectory of his life. He chooses to marry, Jane chooses to marry him, or he chooses to marry Jane, despite knowing that the disease is going to progress.
So she does know.
Yeah.
Because I read something that she didn't find out until after they were married.
I don't remember exactly the way it was. I don't know. My notes say she chooses to marry him despite knowing.
Okay.
He continues his groundbreaking work. He develops theories on black holes, origin of the universe. He changes physics forever, essentially. But as the film progresses, we see ALS really, really take over. He eventually loses the ability to walk altogether. He starts by using crutches, eventually a wheelchair. Then his speech becomes slurred. Eventually, he has a life-threatening bout of pneumonia. He ends up with a tracheostomy. So that, for our listeners, is a tube coming out of your trachea, so in the front of your throat. And he loses his natural voice completely at that point. So he communicates using a speech-generating device, which is now iconic, that is sort of become synonymous with him. So he uses a computer. He pushes the buttons to speak for him. And really, he outlived, like we said, he lived 50 years past his diagnosis.
So he lived longer with the illness than without it.
Exactly, which is remarkable. So he became a renowned science communicator. He really spoke on these complex topics and tried to make them accessible to people. He wrote a best-selling book, A Brief History of Time. Maybe I'll listen to that book if they have an audio version. I don't know. We'll see if it's a little too big for my brain or not.
Fest. Sorry.
Well, they said that they made it more accessible, so we'll see. I've read some of Neil deGrasse Tyson stuff, and he tries to break it down too.
But he seems like a humorous guy.
Yeah, he is. I went to see a live show with him, actually.
Yeah, Stephen Hawking seems very serious, straight-laced, where Neil feels like he can fuck around a little.
I follow him on socials, and I love him. But his prominence extended beyond academia into pop culture, and he was basically a symbol of resilience, science, curiosity, and intellectual achievement. He received so many honors: Fellow of the Royal Society, Commander of the Order of the British Empire, Copley Medal of the Royal Society.
Hopefully he had a sword.
I would assume so, with all these British awards.
If not, let's get him one.
The U.S. Presidential Medal of Freedom as well. You know what I just thought about? So his voice generating thing that you push buttons didn't have an accent. Why wouldn't they have it as a British accent? He's British.
What I was thinking is if he's losing motor control, how is he pushing buttons? Eventually, wasn't he doing the blow tube ones?
I think he eventually used it. Yeah, he did. But think about it. Like, he's British. Why wouldn't his computer have a British accent?
Maybe he didn't want a British accent.
Like,
maybe
it had
he
a
didn't
very
know the difference.
neutral American accent. Yeah.
Yeah.
Oh, this is well.
Although AI sounds like real people laughing at me.
It's weird. Yeah, it's bizarro.
Alexa's new voice, she's laughing at me all the time.
Yeah, we didn't do like the upgrade on Alexa because we didn't get
a choice. I mean, I guess I could revert it. It was like a pilot
thing, and we're like, after a little while, it was listening so much, we were like, you know what? Can we opt out of the pilot for whatever they're doing?
Literally, I asked Alexa to turn on the lights downstairs this morning, and she goes, "Yep." I was like, "What the fuck? No, don't yep at me, girl."
I think honestly, Alexa and Siri, I'm sorry, they're behind the game. I feel like they're less accurate than other things. Sorry, ladies.
Siri's laughing at me. Alexa's getting
my phone keeps lighting up because it hears me say it.
My phone doesn't light up. I guess I have it like not as sensitive, but sorry. Okay, so back to Stephen and his non-accent voice.
Yeah, so despite his profound influence, he never won a Nobel Prize, owing largely to the key aspects of his theories are really experimentally unconfirmed because there's not things that you can physically test.
How? Don't you have to be nominated?
I don't know.
Like, I don't know how you get like your name in the game for that.
Yeah,
like, I know I'm never going to win one, but like, I don't know. Like, I don't think I could apply. Like, you have to have, I don't know.
Yeah. So the big drama in his life though was that he and his first wife eventually,
I was going to say, was not the Nobel Prize. He had some girl drama.
Get divorced, and he marries his nurse who was taking care of him.
He ain't the first. He won't be the last.
And it's like, I don't know. Like the woman, I don't know, who started with him and stayed with him. I mean, whatever. I guess it was.
Did she divorce him because of the relationship with the nurse?
It's not clear how it overlapped, but you know, in the end, it's just a little spicy.
Was this a sexual relationship?
I wasn't there, and I don't think he told anyone the details of that.
I mean, if it's his nurse, she's probably
bathing him and what works and what doesn't work. I don't know what body parts on that respect were working. Here, let me check about his marriage.
I thought you were going to check about what body parts which of Stephen's body parts were working.
Wait, hold on. So yeah, in October he was engaged and they resided in Cambridge. He rarely discussed his stuff. I want to find
not to shade his nurse, but I'm also wondering at this point, like, did he have a lot of money and did she think he was going to leave her some? Because like she knew he was on his way out. Like sooner or later, it was going to happen.
No, actually, his wife developed romantic feelings for somebody
from
their church.
Darn it.
And so
I was going to say for the nurse. Oh my gosh. Dun, dun, dun. More drama.
And yes. And her husband was accepting of it because I guess he wouldn't object as long as I continued to love him. So they kept the family together and she kept it platonic even though she had some feelings. But eventually, by the 80s, it was so strange. Jane felt overwhelmed of the nurses, the assistants, celebrity status, and also like his view of religion because she was a strong Christian and he was more, I guess, atheist. So once he had full-time nursing, he grew close to one of his nurses, Elaine Mason, and February 1990, he told Jane he was leaving her for Mason. So even though she developed romantic feelings, she didn't act on them. The guy was sort of like her close confidant, and then he decided he was going to act upon it.
I mean, it's not a happy story, but also go Stephen for being like, sorry, girl, I got a new one on the side. You only live once. I'm moving on.
I mean, you don't know how long you got in life, I guess. And
YOLO.
So, you know, it's...
I guess I'm a little bit more sus about the nurse, just knowing like when you're in a position like that and like, are you taking advantage? Are you still in the up and up? Is it true love and you're just going to marry this man? Or is it like, hey, I'm the nurse for Stephen Hawking, super rich dude.
He's
famous dude. And he likes me. Yeah. I think I'd be a little bit more sus about the nurse.
And he did have 3 children.
With the nurse?
His first wife.
Say, dang.
Yeah, he had 3 children.
Okay.
So what is ALS? And we'll talk about
It's a
that
motor
little
neuron
bit.
disease.
It is. Other public figures,
I know
we
them.
used to call it.
We used to call it Lou Gehrig's disease.
Correct. Lou Gehrig
after the
was
baseball player.
Baseball player.
That's all I know. I can't tell you. I can't tell you what team. I can't tell you what position.
Yankees.
I'm going to say he was a pitcher.
He was a Yankees. He was a first baseman.
He was a Yankees.
He was a Yankee first baseman.
Okay.
And then Eric Dane, other public figures. It says over the years, musicians, athletes, politicians, and journalists have been diagnosed, but those are the big ones, is Eric Dane and Lou Gehrig, recently at least.
Are you going to talk about, is there a gender differential?
There is, and I will. I'm going to get into the medical in a moment. I just want to briefly mention, do you remember the Ice Bucket Challenge?
Vaguely. I never did it.
2014, people started randomly dumping buckets of ice on each other in order to pledge money to raise for ALS, but I don't know how many of those people actually pledged money. I guess some did.
And also, I don't really see the connection between dumping ice on your head and a motor neuron disease, but okay.
So yeah, you would have somebody dump ice on you, then you would post it online and tag somebody else to challenge them to do it. But regular people did it, athletes, celebrities, politicians, just everybody. It did raise over $115 million for the ALS Association in just a few weeks, but I feel like it probably could have raised more because I bet every single person who did it did not donate money.
Especially once it became like a viral thing. I'm sure people were just doing it to do it.
Exactly. But it did help fund some research, including things into gene discoveries. So it brought it into public recognition, which sometimes with certain diseases, that's enough to get funding elsewhere, even just to bring it into the public's eye. All right. So yes, amyotrophic lateral sclerosis. It's a progressive neurodegenerative disease, affects motor neurons. So motor neurons are going to be things that make your body move versus sensory. So they're nerve cells in the brain and spinal cord that control voluntary muscle movement. So walk, talk, swallow, breathe. Breathing, I would say, is involuntary.
I mean, it's voluntary when you stop doing it. So isn't it the same?
Yeah, but it's in
like you have to consciously stop yourself from breathing. That's what I mean. Like
right,
voluntary.
But you don't have to think to breathe normally.
Right. It's under your conscious control. Put it that way.
Right. So in ALS, these motor neurons gradually break down and die. When the nerve cells die, muscles no longer receive the signal to move, and over time, muscles weaken, shrink, and stop working. And that's the thing about neurons. That's why spinal cord injuries and certain things like that are really devastating, because nerves are the one thing that does not regenerate or replace itself. You have your nerves and they're there, but you don't make new ones. Same thing with stroke, same thing, sometimes they will learn other ones how to take over the job for the other neuron, but you don't make new ones and you don't regenerate. And so that's why anything neurologic is typically, very difficult. So it does not affect sensory. So it does not affect vision, touch, pain, bladder or bowel control, or eye movements until the very, very, very end. There can be some motor issues with the eyes, but for the most part, that's not affected. Cognition typically remains intact. So your mind is there. And that's what's almost worse to a certain extent, because as you're slowly becoming paralyzed and eventually need a breathing tube, and your mind is there. So it's a little bit scary. It is pretty rare. It's 1 to 2 people per 100,000 are diagnosed each year, and typically doesn't present until ages 60 to 75. So Stephen Hawking being 21 and then living into his 70s is very, very unfounded.
And then this was back in the 70s when I would think that it was probably a lot harder to diagnose, less people knew about it.
Right, exactly. And 60% are male. 60-40 as far as that goes. So the lifetime risk is 1 in 347 for men and 1 in 436 for women. So that's that difference there. Most cases are sporadic. They occur without any family history. There's a very tiny percentage they can find any kind of genetic link to. So usually it starts very subtle. You may have weakness in an arm or a leg, difficulty with fine motor skills, muscle twitching, which we would call fasciculation. That's like when you feel like an eyelid fluttering or a muscle, vibrating, cramps and stiffness, and eventually muscle wasting. So some parts of this can be similar to MS, but MS tends to also have sensory issues, can affect your eyes, can affect sensation on your skin.
And MS is not a motor neuron disease. It's a demyelination disease.
Correct. Exactly.
I know
but as far as like that very beginning, like a weak leg or something strange, like it might take a moment. And MS tends to be also more female predominance. Speech and swallowing can occur with some slurred speech, trouble chewing, swallowing your food, shortness of breath, eventually difficulty breathing with lying flat. Now, this is one you know, pseudobulbar affect.
I do know that.
What is it?
Now I'm second guessing myself. It's when you're doing what you do, when you're laughing inappropriately or inappropriate affect.
I'm not inappropriate.
No, I just meant like laughing. So inappropriate affect for the situation.
Right. So laughing or crying when it's not related to appropriate for the situation and typically tied to a neurologic disease. So pseudobulbar affect can happen with almost any neurologic disease, but it's usually not something that occurs because of child I hear in the hallway. Ignore them. So yeah, it's typically linked to another neurologic disease.
Well, and you made me get that pop quiz because I was watching another episode of Brilliant Minds on Hulu.
Good. Yes.
And there was a guy who got in a car accident and essentially, fast forward, killed somebody. And he's like talking about how upset he is and he's laughing hysterically. And they are blaming it on the car accident. Then we later find out that he is a very active hockey player and it is basically from CTE.
Wow. So eventually there can be some changes in thinking or behavior, but cognition is not affected. Unintentional weight loss can also happen because of muscle wasting and probably with your feeding issues. But it starts gradual and then it spreads to different muscle groups over time. So the nitty gritty of motor neurons. So if you think of your brain as sort of a control center and your muscles as workers waiting for instructions, the wires, I always try to explain this to patients like it's electricity. So, because essentially it is, your wires are your nerves. So those are the motor neurons that go and tell your muscle to move. There are two main types. Upper motor neurons carry messages from the brain down the spinal cord, and lower motor neurons carry messages from the spinal cord directly to your muscles. And in ALS, both types are affected. So the reason this happened, it's sort of multifactorial. They don't have one exact perfect reason, but basically the cells can get overstimulated. So that's a fun word, excitotoxicity.
Gets overstimulated and then causes damage.
Yeah. So
excitotoxicity happens often in brain injury.
Yes. So nerve cells communicate using chemical messages. So those are our neurotransmitters. One of them called glutamate, which we've definitely talked about at some point, normally helps send those signals. In ALS, there may be too much glutamate around. So if you think of like something like a car running nonstop, eventually it burns out. The nerve cell becomes overstimulated and damaged. There's also a degree of toxic protein buildup. So inside the healthy cells, proteins are made, folded, and cleaned up. In ALS, some are folded incorrectly, which comes up in a lot of other diseases, which we have talked about and will talk about.
Like Alzheimer's.
Yep. Fold incorrectly, clump together, and build up inside the neuron. Eventually, all those proteins sort of build up and then the neuron can't function. And there's also a degree of mitochondrial dysfunction. Every cell, now do you know, I feel like everyone who has ever taken a science class should know this. The mitochondria is the
brain of the cell.
Powerhouse.
I said brain, that's close enough.
No, it's like
it's the important part.
It's something you had to like memorize. It's the powerhouse of the cell.
Didn't have to memorize it.
But basically in ALS, these powerhouses aren't working properly.
Which you'll have to cover mitochondrial disorders at some point in the future.
Yes, that's fairly complex and uncommon, but yes.
Sorry.
But without energy, the motor neuron can't survive. So there's multiple ways these are being damaged. Inflammation also is part of it. So cells that normally protect the nervous system, microglia, may become overactive. So instead of defending sort of the nerves, they may release chemicals that add to the damage. So almost like friendly fire, like something that's doing its job too well, like kind of like autoimmune diseases.
That's
where
what
your
I was
body's
thinking.
like a
Works
little
against
extra.
itself.
Yeah.
Mm-hmm.
And then, there's some breakdown of transport. So motor neurons are very long cells, right? Very long. And some stretch from your spinal cord all the way to your feet. Like we're talking like if you think about veins and arteries, and they rely on little highways to move things through them to send signals up and down. In ALS, the transport system can break down. So the cells slowly starve. So it's so many different things going wrong. And eventually the motor neuron dies. And when that happens, it can't send a signal to your muscle. And so your muscle can't do that function. So we have different muscles for different things. So we have in every sort of extremity, sort of you have an extensor that pulls something up, and then you have a flexor that pulls something down. So you might lose your extensor function first and then later use your, because a different nerve is going to do the flexor function. So there's two different nerves for those things. There's also abducting and adduct. So out is abducting something, adduct is toward. So that's a different nerve and a different muscle group for that and for that. So it's not like your whole arm is dead immediately, but you may first lose one part, then the other part, and so on and so forth. The muscle eventually weakens and shrinks down and atrophies. It's just not getting the power. It's not the muscle isn't the problem. It's just not getting the signals.
But then when it doesn't get the signal, it's not getting used, then the muscle starts to break down.
Exactly. And it just kind of shrivels up. And eventually, like we said, the speech, the swallowing, the breathing, which is really detrimental and eventually often needs some sort of a support for breathing. So like we mentioned before, sensation's not effective. You can feel everything. And thinking, like we said, is typically preserved. It is progressive because they don't regenerate. So once they're gone, they're gone.
Because you can feel everything. Is it painful?
So there's not anything described as significant pain in what I've read, but limited mobility, you're going to be more at risk of wounds. You're going to be more at risk. There's other things that could cause pain, but like not necessarily directly affected by it because it's not like your sensory is more, it's just normal.
Right. So like
and it's
when
not
the motor
like you're
neuron
cramping.
dies.
Right.
Yeah. You don't feel it dying. You don't feel that pain.
No.
You just feel the gradual loss of sensation or loss of
not
movement.
sensation, just movement.
Loss of movement,
Yeah. So there's not really a single way to diagnose this. It's really a clinical diagnosis based on your history, a neurologic exam, EMG testing. So that is the myelogram. So nerve conduction test and electromyogram are where they put the little needles in.
I've had that. It's not fun.
Me too. It isn't. So one is testing the motor function going down from said neuron, and another is it coming back. MRI will rule out structural things, but there's nothing to see on MRI. And blood tests to just rule out other things. But it's really the EMG, the exam, and the history are the diagnosis. It can take 10 to 16 months on average from the first symptom to get diagnosis.
And I'm assuming that's if you go to the doctor after the first symptom.
Yeah, exactly. And if it's very subtle, it may take you a moment. And then trying to get into a specialist, or if you aren't established with a primary care. If I had a patient who was established with me and I had a big concern for this, I'd be calling around to neurologists myself to get them in right away.
Right.
But access to care is going to be limited by where you live, your access to specialists,
your insurance,
right,
or lack thereof. Yeah,
exactly. So there's currently no cure at all. There are some things that can slow progression a bit and help it improve quality of life. So there's something called riluzole, may extend survival by several months. Edaravone may slow functional decline in some patients. I don't think I'm going to be able to say this. Let's see. Sodium phenylbutyrate taurursodiol.
You did it.
Shown to slow progression. And tofersen, approved for certain genetic forms, but that's pretty uncommon.
So then how did Stephen live so long?
Luck. I guess, he had the breathing supports. I mean, I guess you could elect once you get to the breathing and the swallowing issues to not manage those. I don't know Eric Dane's specifics.
Yeah.
But if you wanted to just allow a natural death, you would not do that tracheostomy and you would not do a feeding tube and you'd have natural death, where Stephen Hawking did all those things and had, the care to turn him and move him and make sure he didn't get wounds and the ability to do all those things. But I think that's the main thing is you don't die from not having the muscles to move. You die from not being able to breathe, not being able to eat, or infections because of your lungs or wounds, aspiration, pneumonia, things like that. Yeah. So basically ventilation can improve survival.
It reminds me a little of Huntington's, where it's like,
yes,
you have this slow body death, but you have the cognition
Right.
stays, and
Yep.
you kind of just make those choices on how long you want to survive, unfortunately.
Exactly. Yeah. So yeah, I mean, the typical physical therapy, occupational speech therapy, they might help you to manage. It's not going to bring the muscles or the nerves back, but it can help you to compensate in certain ways and learn how to adjust to help with your independence. Yeah, neurologists, respiratory therapists, nutritionists, rehab specialists, just to help with that quality of life. Right now, they're really, of course, researching heavily into things like gene therapy, stem cell therapies, targeted molecular therapies, better biomarkers, something we can put our fingers on to diagnose this early. So it's, it's a sad and scary disease. I'm glad that it's not common, but at the same point, rarer diseases have a harder time getting meds made and discoveries made. So awareness, advocacy, science continuing to push to look for these. So that's why I think it was great that at least we could hopefully offer a little spark for people to learn, research, go donate to one of the ALS organizations. And that would be, helpful to push this forward. And hopefully just at least with these people who have been famous, who've passed from it, maybe that awareness helps somebody else maybe who doesn't have that because it brought it to somebody's mind.
And you mentioned it before, it sounds like there's not a clear genetic link, or that's just one specific type of ALS?
One specific, very rare, uncommon type. Genetics really don't play a role. It is very much just sporadic, but we really don't have an underlying reason. We just don't. That's what's scary. And that's one of the frustrating things with a lot of things that I tell patients. And I say, there's nothing you could have done to cause this or prevent this. This is a strike of lightning. You were just the bad luck. Like there's other diseases out there like that. And it stinks because it's like you did nothing wrong. There's nothing you could have changed in your diet, exercise, or lifestyle or anything else. It's just bad luck, bad odds, essentially. So yeah, I mean, hopefully, like I said, this brings awareness to things and, people look into it a little more, maybe donate. And obviously, if anyone is having any weird neurologic symptoms, absolutely, the sooner you get things checked out, the more things that can be done to help slow progression of anything. And that includes MS, ALS, or anything that's especially a neurodegenerative, because those, once you lose those nerves, you don't get them back.
I think too, and we haven't really spoken about it too much. I think for a lot of folks, sometimes just having a diagnosis or something to call it kind of brings some sense of peace, because at least now you kind of know what you're dealing with, or, what your options are versus, I've got like this weird, like numb feeling in my hand. I'm just going to ignore it. And then like you kind of get anxious about it. You think about it. But I think even though it's not a diagnosis anyone wants, I think for some people it can be really helpful.
Absolutely. Just to know what's going on and to give a name and something to it and hopefully get the help you need.
Yeah.
So it's a little bit of a bummer disease,
A little bit. A lot of it. Let's just
call
it
but, Stephen Hawking, I think, he was someone who contributed significantly to the science. And hopefully, people take from that and find things to cure other things.
And going back to Eric Dane and Brilliant Minds, there was actually an episode that he was in where his character did have ALS, and he talked a lot about the struggles and the frustration and the fear that goes along with it. It was a really touching episode because this particular person had kind of his character had alienated himself from his family because he didn't want his family to see his decline. And with the help of psychology and neurology, was able to reconnect with his family and really enjoy those last few years that he was going to have with them and let them be a part of his life again, which I think I could see that happening for a lot of folks. If you find out you have this essentially terminal disease, not kind of thinking you're sparing your family by separating yourself from them, but you're also, you're losing out on your own opportunities to make those positive memories with them.
Yeah. And so he was separated from his wife, but they did not divorce. And she's the Noxema girl, right?
Yes, Rebecca Gayheart.
She's the Noxema girl, okay?
Yes.
Anyone who lived in the 90s knows who I'm talking about.
Well, and he did a show, which I've yet to watch, but is called, is it Last Words by Eric Dane on Netflix?
I didn't watch this yet. I know. It all just happened quickly.
Famous Last Words, yes.
Yeah.
But he did record it and made the caveat that he did not want it released until after he passed.
Yeah. So
A lot of
everyone go out
people
and
were
watch
kind
that.
of, yeah, a lot of people were kind of trying to shame Netflix for it, but those were his
No,
explicit wishes.
that's what he wanted.
He
That's
wanted
it.
that. And I think that's kind of the point of the show, is for somebody to get that opportunity in their own terms, in their own words, to say what they want to say to the people that they love about whatever's going on with them. And I think that's, you can say what you want about media, but I think that's really a good outlet for that, for him to use his celebrity in that way to share those final messages with his kids. Because I know there was a whole thing about how he spoke to his daughters, and I only watched a little clip of it and it made me cry, and I was like, I'm not emotionally ready for this. Not in the snow, not in the winter depression mode that we're in.
Nope.
That's why I turned on Bridgerton instead.
Yep.
But yeah, it looks like it's really touching, and I don't know if Netflix is going to do that again. I don't know how many times opportunities like that come up, but
where somebody,
I mean, I'm sure there are situations, but I have feelings about the premise of a show like that, but he did it willingly. So.
Right, of course. Okay. So
that was super exciting and fun and uplifting. Thank you, Tara.
My last, well, no, we switched this. So no, yeah, I switched this with a different one. So
no,
my
girl.
fun one's going to come later. We're moving our episodes around. I'll make, my next one. I don't know when I have a fun one again. We need the fun from you. Okay. Bring it.
My next one's not fun. Sorry. And the one before this the one before this was a little bit fun, but not as much fun.
Yeah. All right. Well, thank you for listening to Medical Media Mixer.
The perfect cocktail.
Cheers.
You didn't even show your drink before.
It's not black. It's supposed to be black.
Thanks for tuning in to this episode of the Medical Media Mixer podcast. If you enjoyed the conversation, don't forget to subscribe, rate, and review us on your favorite podcast platform. Your support helps others find the show. Want to keep the conversation going? Follow us on social media. We're at Medical Media Mixer Podcast on Instagram, Facebook, TikTok, YouTube, and on Pinterest, the Medical Media Mixer board.
If you'd like to support the show and help us grow, check us out on Patreon. Patreon.com/Medical Media Mixer Podcast. And on Buy Me a Coffee, buymeacoffee.com/Medical Media Mixer Podcast. If you have a topic idea, feedback, or just want to say hi, send us an email at medicalmediamixer@gmail.com. You can also stream all of our episodes and find more info on our website, medicalmediamixer.podbean.com. We're available on all major podcast platforms, so no matter where you listen, we're there. Thanks again for listening, and until next time, keep mixing medicine and media.